Thank you for joining us on another Factor Care podcast. My name is Stephen Lee. I'm joined here with my buddy Josh. And today I want to talk about joint health. You know, it's a popular topic recently, and I've heard some conversation in there. And I was wondering, I was trying to maybe get some information out to the masses that of our personal experience with joint health. So I know yourself and I, we've been through surgeries. We're both hemophiliacs. We have hemophiliac-related arthritis. We've had surgeries. We've dealt with a lot, and maybe that will help others understand what they're dealing with.
Sure.
So I want to start off with, like, when we talk about joint health in general, well, what's actually going on when we say we have a joint bleed? And I want to bring some clarification. Well, when we have a joint bleed, that's basically hemarthrosis. We have blood going into that joint space. And what people don't realize is that when we have that bleeding into that joint space, that synovial lining that's filled with the fluid that lubricates our joints, it brings inflammatory mediators and things of that nature with it that's actually attacking that area. So you're going to have less fluid movement. You're going to have inflammation that's causing a lot of the pain. You're going to have possible arthritis associated with it over time. It's not going to happen after the first bleed, but once it starts happening more and more frequently, you're going to
break down.
Exactly, we've broken down. So, like, for instance, myself, I had elbow bleeds for the better part of my teenage years into my early 20s, to the point where surgery was the only option I had left. I mean, I couldn't maintain the pain. I couldn't maintain the lifestyle. I couldn't maintain having 3 to 4 bleeds a month in that elbow. And
how old were you when that started? Do you remember?
So I was in my high school years, so probably about 15 to 18, somewhere between there. I remember that it really picked up when I started working out. So I was in high school, not much to do in the small town I'm from. So after school, we went to the gym. So I'd go to the gym just like everyone else, and I'd bench press, and I'd do all the various exercises. And just about every week, I'd come home, and my right elbow was swollen, and I'd be out of the gym for 3 days. And I'd be in excruciating pain.
Yeah.
And unfortunately, I was misdiagnosed because I didn't follow up with my HTC at the time. I was diagnosed with tennis elbow, was just given NSAIDs. I was giving Vioxx. I was given Vioxx prior to the lawsuit. And that was just used to maintain the pain until the next time I get the range of motion back.
How often? Do you remember?
Yeah, it was
often?
weekly.
So you'd take 2 or 3 days off from the gym, and then you would come
and
back.
I'd come right back to the gym every day until it happened
over
again. Yeah. So finally, unfortunately, it took a couple years before I consulted orthopedists, and when they took the X-rays, they really found out that my joints were just gone.
Damage.
Zero cartilage left, bone on bone, deformation of it. I ended up with a radial head resection and a synovectomy in both of my elbows. But, that's one of the things we want to bring attention to, is that, there are biological or anatomical effects on your body when you have these consistent bleeds, and which we'll call a target
joint is basically the key term that we always use.
Yeah, so we wanted to say, we went through it. We've seen what happened to it. So how can we go about helping others manage it? And that's the real thing about today, is how do we manage, knowing what we know now, how will we go about managing these bleeds? So, like, Josh, you tell me, I know you have knee problems, you have ankle problems. What do we know now that can help us manage our joints?
So at where we are today or where we were before? So which one do you want to do first?
So actually, we're going from where we are today because we've learned so much. We want the newer generation to skip out on the surgeries that we've had.
Right. So we did an entire episode on my knee, basically after the knee replacement was done this last year, which was still less than a year ago. And it's always been about trying to keep the range of motion, and physical therapy was a big part of that. I know for me and you, I have a specific ankle, which is on the same side, my right side as my knee was, like a low tire. Your gait gets off for so long in such a long period of time that it just starts to wear and tear on the wrong areas of your body over and over again. That's that slight variance right? When you're walking in the wrong way over and over and
Yeah.
over again.
Yeah. Absolutely.
So I had the MRI last week on the ankle.
Yeah.
And I sent you the results of that, but basically I'm bone on bone
Yeah.
there as well. But I was really curious about the elbows for you because it's something that I haven't dealt with. That so many of my friends that I've met, it seems like everyone that's a severe, and most people are severe 8 deficiency, but with the bleeding disorder, it seems like elbows are a real target for of consistency for people in that bleeding in that area. And super grateful not having to deal with that. Um, yeah, at the phase I'm at right now, having a new knee, which is awesome because I'm not in pain anymore. I don't have the discomfort. My range of motion is a lot better. And right now, I had so much atrophy in that quad above the knee from years of not being able to utilize it the way I needed to, is a very slow progression of physical therapy to try to build that muscle back up so that I can get more stability around the joint and that side of my body to try to get it to equal out a little bit more to get the gait where it needs to be. So it's a constant process of trying to go back in the right direction.
But it's crazy to think that you were in so much pain with your knee that your ankles were bone on bone, and it was an afterthought because you were just dealing with your target joint at the time,
Right.
which was your knee.
Well, you used a great term, which when we were talking yesterday, which is compartmentalize.
Yes.
So I think it is as filing it away, but I like the word better of compartmentalizing the pain.
Yes.
It's almost like your brain prioritizes. Okay, this is where I'm hurting, and this is the area that I'm hurting most in. So at least that's how when you describe it, you're describing the way I process it.
Yeah.
So I'm assuming that is pretty consistent for a lot of people.
You know, a lot of hemophiliacs, because of the bleeds that we have and the pain associated with the bleeds, we have to find ways to deal with it. Now, some people may go to prescription medications, over-the-counter medications, different ointments and rubs that are available. And then some people that have been through it for so long, like ourselves, we realize, man, a lot of that stuff sometimes it barely takes the edge off. Our brain is so powerful that if we put it up to the task, sometimes it's able to just compartmentalize that pain, and it's like, hey, it's there, but we're going to put it over here and we're going to concentrate on this today. Like, we still need to get our job done. We still need to do these things. And not saying anything about alternate therapies. They're warranted. I want people to know that, hey, if you need it, take it.
Yeah.
But also, you can also be impressed by how much your brain can do. It's one of those things that, I think people need to assess the situation. Every bleed can be assessed, and you're going to go from different severities because, if you're so used to, I know growing up, I was given pain meds, and I just took it to take it, even if I wasn't in pain, because the direction said twice a day.
Right.
I mean, don't get me wrong, I was living in pain every day, but it wasn't, some days I probably could cope better than others. But now I don't take any meds besides my Celebrex, and the pain, the inflammation and pain that I get when I do have a bleed, I play it by ear. It's like, okay, well, how bad is this one? Can I get by with using a Tylenol? Can I get by with using an Advil? I know that's very taboo. Oh, we're free bleeders.
It seems to be like the new.
We're free bleeders. We can't take anti-inflammatories. Well, that's a question for you and your healthcare provider. But in my own case, with me staying on prophylaxis and limited use of it, it's actually helped decrease my inflammation and pain for some joint bleeds and muscle pulls and things of that nature. But yeah, so you assess it, and so it slowly goes up. Oh, this one's really bad. Maybe I do need, something a little harder. Maybe I do need, but for a lot of times for the chronic ones, the ones that are like my ankles are always hurting. My brain has been so great at over the years just putting it away. It's like, yeah, it's there, but once my day gets going, we try not to think about it, and it's been it's allowed me to not rely on meds just to live. And once again, I am not saying that and everyone shouldn't take medicines. I'm saying that there's a time and a place, and it's up to you to make that decision of when it's appropriate for you,
along with your healthcare
provider, and that no one needs to suffer. That's another thing is when my mind compartmentalizes it, I'm not suffering. I'm not even thinking about it. but you shouldn't. If you cannot compartmentalize it, I don't want you sitting there crying in the corner of the room
Yeah.
because you're in so much pain. No, no, be
Yeah.
comfortable. You have every right to be comfortable. But yeah, so we want to bring attention to, like, what can we do for treatments? What do you do when you have a bleed? I
Yeah.
think that not a lot of people have been taught the RICE method. It's going to be rest, ice, compression, and elevate. When you get a bleed right away, ice it, lay off of it.
Yeah.
I mean, it's basically your body's way of saying, hey, this hurts, lay off of me. If you still felt comfortable, you're just going to damage it some more. Your body's telling you, like, hey, lay off of me. I think that's, so many of us.
Being younger, that's where I think I made a lot of mistakes. And as far as the medication route goes, I know I didn't even have. So I had an emergency appendectomy when I was 12, and the one thing that stands out on that event, outside of the fact that I had an infant brother who was going through a surgery. I'm at Children's Hospital. It's a random story. With my parents, I can see they've got their 1-year-old on the operating table. I'm in the waiting area with my middle brother, Sam, and I go over and tell my mom, which I did not complain, that my stomach was bothering me. She's like, not right now. Like, and I know that she wasn't aware that I was saying something, because they would always tell me, like, you never complain. So we should have seen that as an indicator. Well, a couple hours later, I was on I had an emergency appendectomy. So they had 2 kids in the.
Well, thankfully you're in the right place.
Right. No, it was perfect timing. 2 lanes, the HTC was right down the street. So, like, Karen and everybody was there. It was awesome. They did a great job of taking care of me. But when I came in recovery and went back to the room, the nurse came to check on me and said, "Are you uncomfortable?" Well, this is before the orthoscopic. So they were, it's a couple inches, of a cut that you have on your side. I can still remember the nurse's face when my dad was like, "Just give him an extra strength Tylenol." Her face was just like, what? And they went outside, and that's what I got. I got 1 extra strength Tylenol. So I say that to say, I was very ignorant in my understanding of pain medication in general. So when I was far beyond a place where I probably needed it to help, if nothing else, rest when I was done working, because I had a physical job for years, where I was on my feet all day, 12, 14 hours a day. When I started to take the pain medication, I was not aware of the effects that my body, the way it was going to respond. So I know for me personally, it went from a need to a want. And so there's a transition period there. And as I'm reflecting back over, a while now, trying to learn how I processed through that, it was like I could grind through anything. But one of the worst things that happened for me was them showing me that I could be out of pain. Because that moment of being out of pain created a new want to be out of pain all the time. And then it creates the drug did what it would normally do as far as the narcotic side. And I had definitely had some hard roads to go down to figure out what was best for me. And I say all of that to say, if you need it and your healthcare provider is saying this is what you need to do, then you have to rely on that, because there are people that absolutely do what you're saying, need the medication.
Absolutely.
And I'm so grateful that we have it. I'm so grateful that we've had it. We both had multiple surgeries. It's nice to, at least in the first couple of days after the procedure, to know, like, I'm not going to be in excruciating pain after this is done, only to try to get out of pain again and hopefully not have this reoccur.
Yeah, and people need to realize that there's a difference between illicit use, dependency, and addiction, right? So, and some people are more prone to it than others. But if you need it to maintain your lifestyle, you need it. But if you're getting to the point where it's not controllable, then you may need to seek additional help, and help is available.
Yeah.
You just have to own up to it. But once again, if you need it, you need it.
Yeah.
It's just one of those things that in this world, one of my reasons why I personally chose to discontinue the use of opiates is because of how many hemophiliacs I've met that passed. And that was eye-opening. It's like, I never had a dependence issue, but at the same time I told myself, I have a family to live for. I have so much to do. I want to prevent that. So it was an own personal choice, but I do not hold any bad feelings for anyone that does use it,
Yeah.
because you deserve every right to be comfortable.
Yeah.
And it's unfortunate that some of these drugs have either can cause dependence and or some sort of addiction. But there's a help available, and as long as you stick to your traditional routes of medicine, meaning that you're getting your meds from your doctor and things of that nature,
Yeah.
you're probably going to be well taken care of. But that's not the only way we treat our joints. I think
Sure.
we should go back a little bit, and besides the rice, besides the
Which I was not good at following, by the way.
yeah,
So I don't. There's something about the ice that after
yeah,
I was already bleeding, had the
yeah,
swelling, the discomfort. We talked before about. And I don't know if it's consistent, but for Steven and I know we both have talked about. You can even feel like warmth. And I remember
yes,
going to the HTC and them kind of running their hand over it to see
hmm
like how warm it
yeah,
was.
yeah,
Because if you can go from one part of your leg, like say the calf, work your way to my knee, you could feel there's a temperature difference there.
absolutely,
So there's something going on. It's not just the swelling and discomfort. There's multiple indicators. But for me, I would infuse, I would elevate. So I've skipped some steps
yeah,
there, but I would infuse, I would elevate, um, be in discomfort, whatever that looked like. But I did get some relief from heat. So I would take, and it's still due to this day,
hmm
take basically the hottest bath that I could stand for anywhere from 10 to 30 minutes.
wow,
And then when I would get out, I would definitely feel some relief. I think the change in temperature that's dramatic does something to your body on a cellular level, but also I felt like, okay, I've got a little bit more range of motion. It might be
hmm
microscopic, but I could feel a little bit better. And even if it's just my own mental state,
yeah.
it helps a lot. It helped
Well,
me a lot.
that's a big topic of discussion between ice and heat. And some people are like, oh, I heard you're supposed to ice it. Oh, well, heat works well when I pull my back and things of that nature. Well, I guess the general rule of thumb is immediately after the injury, you ice it. So the hopes is it keeps the inflammation down.
Yeah.
It tightens up those capillaries, prevents the oozing in the blood and the inflammatory mediators from getting into that spot. But that only lasts so long. Once the inflammation, everything's established, a lot of times the ice doesn't do much after the fact. So that's when heat comes in. Usually on the tail end, like when I tell people that have big bruises and whatnot,
Yeah.
I'll tell them put heat on it, put a heating pad on it
It
from time to
really
time.
does help.
And the mindset would be after it's already there, it opens once the inflammatory response has already taken place.
Hmm.
We're at a place where now it's time to make it go away. So if you put the heat on there, it opens up those capillaries and allows the blood to retract back into
Yeah.
the cells and into the
It's a
into the
much better
capillaries to
feeling
pull
when
it
you're
away.
already uncomfortable and you've
Yeah,
got that swelling and the swelling starts to go down.
yeah,
Yeah, it helps.
yeah,
At least it
absolutely.
did for me.
But yeah, so I mean, that's you brought up infusing. So for myself, when I hurt myself, immediately part of my protocol with my hemophilia treatment facility is that I have PRN doses. I give
Yep.
myself a dose immediately. For the most part, I mean, it doesn't hurt. I mean, if you're, one thing is helping to identify a bleed. So what is the bleed? Like, oh, usually if you have, warmth, pain, a limited range of motion, bruising, if you have that going on, you may be experiencing a bleed. Go ahead and give yourself a dose if that's the protocol you have with your team. Ultimately, because obviously we can't get the meds without them. But it's one of those things where I'd rather have a high factor level on hand to give myself the best chance of stopping it, and then the best chance of getting over it quicker.
And I was about to say the speed and recovery time is a lot of that's due to how quickly you can get that infusion done.
I mean, and that's the whole point of prophylaxis. We have factor on hand in our bodies to be quote unquote normal, so we have it on hand. But I like to give myself a little bit extra when I do experience something, because I may not know where on that curve my factor level falls at the time of the injury. Now, if I get injured the day after I infuse myself, I
Yeah.
might not give myself another dose, depending on the severity of the situation.
Yeah.
But we need to be able to identify the bleed, treat the bleed appropriately, and understand that it's conditional. Not every bleed is the same, So if that bleed fell on the day of your prophy dose and you're on a long acting, maybe you don't need to do something.
Yeah.
You still probably would benefit from laying off of it. You still probably would benefit from icing it immediately after the injury. We will have and understanding, hey, so I'm a little uncomfortable. Should I get the Percocet? Should I use my Advil? Well, maybe this is an Advil situation.
Yeah.
And then it's like, oh, I can't take Advil. Well, talk to your healthcare team, see
Yeah.
if it's appropriate for you. I found myself with limited use, and I'm okay. But at the same time, I found myself on the other end of the spectrum, taking too many and ending up with a stomach ulcer.
Yeah, it's crazy story.
So well, that was my journey when I decided to not take opiates whatsoever. I took too much Advil,
Yeah.
and I've been on Celebrex since then, which is less likely to
Which we
cause.
both are now
Yeah,
because of our conversations in the past, and it's been really a godsend in a lot of ways to helping with inflammation.
yeah. So it's less likely to cause the stomach bleeds, the blood thinning, and things of that nature. So it's helped maintain that inflammation to the point where we can go by our
manageable.
daily business. So yeah, I mean, I think we touched on a lot of good topics about pain management and how you identify things and how do we treat it. I think the last topic we really need to talk about is you've had surgery, I have surgery. How do we know
Yeah.
when it's time to have
This is
surgery?
the big one, right? So this
Yeah.
is the one that's like you try to. Now it depends on a lot of different, for lack of a better term, factors. So
Yes.
I know for my knee that was a given. We wanted to do that as quickly as possible. When I realized this is beyond a point, I'm getting the most sweetest and polite threats ever of like you could potentially lose your leg. You've been doing this for so many years on bone that the joint is breaking down. We need to be able to do something quickly. Now everybody's situation is different. I had good insurance at the time. The hospitals that we got to 3 different ones, and within 24 hours of this procedures, they were calling me and my wife saying, "We can't do this. We're sorry."
Wow.
Because it would get to the board of directors. The board would see the increased potential for bleeding out on the table or whatever it was, the liability associated with someone like ourselves, and say, "Okay, well, we're not going to be able to do this right now." And they would try to. Thankfully, they would try to reroute us in a different direction, but we just kept running into walls. It was 7 years of that.
Yeah.
So when I was able to do it this last year, we moved so quickly because it was an opportunity to get it done. And like, man, we could be out of pain. It's not just the quality of life for ourselves, but our families, because it impacts them, right?
Yeah.
So whole different story for a different day. But I knew with my knee that was a given. I think that the technology and the knee is so simple in the way that it's put together, makes a big difference in being able to make a decision like that.
Yeah.
You're dealing with a situation right now with your ankles, and I'm dealing with one myself, but I don't feel like it's as severe as what you've been dealing with. But the ankle is a whole different animal. The
Yeah.
replacement is a different animal. There's a
Yeah.
lot of moving parts. Like it's a lot more complex, and the technology may not be at a place where we really want it to be yet to be able to make that decision.
And just like how we manage our bleeds is a very personal choice on the route that we take. It's the same thing with surgeries. So when I was looking into the potential for an ankle replacement surgery, uh, the surgeon pretty much told me, he's like, "Steven, you will know when you're ready." And he was so right, because when I decided to do my right elbow, I was in pharmacy school, and it got to the point where I couldn't lift up my laptop to put it on the table with my right arm. It was affecting my life. I knew, hey, I need to do something to get some strength in that arm, to get some correction so I can continue on with school.
Yeah.
So I did my synovectomy radial head resection on my right elbow. But then with school and everything going on, it's kind of hard to take off. I kind of put off getting surgery. But then I knew that, hey, in my late 20s, I'm going to get married and I want to try to start a family. And I didn't want to start a family and not be able to hold my kid up and without being in excruciating pain. So I decided, hey, let me get my left elbow done, because it was in worse shape than my right. But since my right was strong, I was able to do most of the things that I'm able to do.
Yeah.
So I decided to do that. So it's at the time in my life, I knew it was right for me. And that's what, like the doctor was reinforcing, when it's time. So as far as my ankles go, there's so many things that you factor in. You want to factor in, did you try all of the less invasive things? Did you try medications? Did you try injections, like steroid injections, like different types of lubricants like Synvisc and things of that nature? Did you try the other things like braces, air casts, just orthotics?
Yeah.
Did you try all the other things before you go into the most invasive? Because nothing's a guaranteed fix. I mean, I spoke to a hemophiliac with an ankle fusion not too long ago, and he goes, man, it's like I did the surgery and I don't get the bleeds there, but it still hurts. And it's like,
Uh,
well, dang.
yeah, yeah.
Well,
Well,
dang.
and then we've had people that have unfortunately had them done backwards, so they do it
Wow.
by that random chance that something could go wrong. But again, this goes back to based on your life and each individual
Yeah.
person and trying to steer someone in the right direction. I think that team that you're building, the healthcare team that you're building with, it's so vital to being able to get good information in to process it and then make a decision and be able to move forward.
And listen to the people around you because they're gonna know is like, hey man, you've been kind of bitter lately. You've been kind of out of it. Like
Yeah,
when it's affecting your quality of life to the point where you're shelling yourself off and or you're not able to do the things that you need to do.
yeah,
It's definitely worth the conversation. Like, hey, how can I correct this?
yeah,
Because you don't want to get to a point where it's hurting you so much that you're a different person.
yeah. That's why I
You
drag you
know.
around with me all the time.
Yeah. So I mean, I think that's really, that's really key. Is like, how do I know? Well, it's a very personal decision.
Yeah,
I know fear is a factor. I know money's a factor. I know insurance is a factor.
yeah.
These are all things that
We're all dealing with.
we all
Yeah,
deal with. And if you're waiting for the perfect time, that perfect time might not come. So know that, hey, but you will know when it is the time. You might not know when the perfect time might not come up, but the time comes up. And I think that's important for people to realize that, you know, it's gotten to the point where I don't leave the house because I don't want to walk. It's gotten to the point where I can't work. It's
yeah.
gotten to the point
It's
where
so distracting that you can't functionally. And
yeah,
I've been there.
and it's affecting your relationships.
Yeah,
It's gotten to that point. Well, it may be time to get that surgery, and the hemarthrosis is one thing, right? The arthritis associated with getting with having multiple bleeds in a joint. That's one thing, and we can maintain it. But it gets to a point where, a lot of the things that we're doing are band-aids
hmm,
and the real fix, because once the damage is there, the damage is there.
right.
The real fix may require intervention, and that includes a knife.
Yeah.
So
We've both been there.
yeah,
But no, this is good. It's good. We need to elaborate, I think, down the road on more of the conversation and bring in some other. I'd love to bring in some other physicians to be able to walk us through some of the specifics of even what we're dealing with right now with your ankles, with mine, because I'd like to get up on the technology on what's happening. So everybody educate yourselves as best you can. I think that's a big
absolutely.
deal. Do as much reading and have as many conversations with as many people that you know and that you trust as possible.
Hmm.
And then if you're not comfortable with the medical team that's around you for whatever reason, then find someone that you are comfortable with, because everybody is not a good fit for everyone else. It may not be the medical professional, but you hear a lot of times too, like, well, my hematologist, I'm like, look, they want what's best for you, then they're going to want you to be where it's best for you.
Yeah,
And I think that most physicians are that way, regardless of how it impacts them financially. They do really want you to be healthier.
yeah,
And that's the intent from a lot of these people that I've run into over the years. So I'm extremely grateful for them and the ability to be able to have
yeah.
things like pain medication when we really need it. Things like, the ability to be able to do surgeries or even do an MRI like I did the other day
Yeah.
and see the cartilage. Like,
Yeah.
where's the damage? What's going on?
You
I'm
know,
just grateful.
and another one of the things that you mentioned is talking to people. Well, sometimes your healthcare team can get you in contact with other people going through the same thing, and you can pick their brain. If they
Right.
can't do it, a lot of these advocacy groups, your local charities, foundation set up for people like you can meet people that are going through the same things. Maybe
Yeah.
some people a few years ahead of you, some people a few years behind you.
Yeah.
But you can pick the brains of the ones with experience, and then you can bring that knowledge down to the ones that don't have as much, and we're just all in one community trying to help one another. And basically that's what we're trying to do with
Yeah.
this platform, is to be able to help another person that's maybe not as bad off as we are right now, but maybe the information we can give them may help them prevent to be where we are right now.
Yeah.
You know?
Hopefully this encourages somebody out there.
Yeah, absolutely.
Yeah. It's another good one.
All right, I think we
Do it
have.
again.
Was it?
We'll do it again.
Yes. All right. We'll join you next time on our next episode. Look for us on all the streaming platforms.
Appreciate y'all. Thanks, everybody.